And from Diabetes and Endocrinology Consultants, Dr. Kajin Lucas is in the house. Good morning, doctor. How are you?
Good morning. I'm great.
Good. Now, what are we talking about today?
Why bother with treating blood sugars?
Why bother? Why bother? Just let it ride.
Yeah. I mean, a lot of people say, well, that's normal for me to have a blood sugar of 200 all the time. But there's reasons for it. One reason is that people don't feel as good. When your sugar's high, you're not using that sugar for energy. It's just floating around, creating problems. So a lot of times you'll be thirstier, urinating more, you'll be more tired because you're not using the sugar for energy. You might have blurred vision. Women and men can get yeast infections because yeast likes sugar. So that's part of the symptoms that you can have when you have diabetes. You can have tingling in your feet, and you can just feel, it's just mainly tired, muscle cramps, achy.
Yeah, it seems counterintuitive because we think about sugar for energy, but yet you feel lethargic if you're high.
Well, because the sugar's not going where it needs to provide energy. So it needs to get into the cells of your body to give them energy, and it's not getting in there, it's just floating around. So it's just your body senses that it doesn't have enough sugar, actually, because it's not getting where it needs to go.
So is it just because it's not processing? Walk us through a little bit of the biology there.
Well, the insulin makes the sugar go into the cells. So it opens a little door, lets the sugar in. If you don't have insulin, or the insulin doesn't work right, it's not going to do that. Or it takes more insulin to open that door, a bigger key. And you make more and more insulin to open the door, and that may work for a while and keep the sugar down. But then your pancreas starts wearing out if you're making that much insulin.
It wears out the production line there.
Yeah.
Right.
I mean, pretty much it happens. The longer you have diabetes, if you're type 2, your pancreas just can't keep up the high production, for that long.
Right. Okay, so again, this is when we say why worry about it, is that some people probably feel like this is just how I am. You just said this is my normal blood sugar, but also this is how I feel all the time.
Right.
I don't know anything.
And they may feel that way all the time, and they may have felt that way for years.
They thought that was normal.
And they thought it was normal. And also, if you're getting up at night to go to the bathroom a lot, 2 or 3 times a night, then that disrupts your sleep, and you're tired that way too. Some of the people with diabetes have sleep apnea, and that disrupts your sleep. So anything that disrupts your sleep also makes you tired, in addition to the sugar just being high and making you tired. But a lot of people don't, once they're on the right medicine, or they get their sugar controlled, then they go, well, I feel great now. Like, they don't realize how bad they felt before. So they, once they're treated and they feel better, then they realize they weren't feeling good.
Then do they also sometimes react like, well, I don't need this now. I feel fine.
Yeah, I feel fine. I've lost 5 pounds, so I can stop the medicine. And then they realize, well, they can't stop it.
Yeah.
Because the blood sugar goes right back up. So you're treating a genetic disorder with medicine to help correct the genetic disorder. And if you stop the medicine, the genetic disorder doesn't go away unless you change your genes, which, maybe in the future they can do that.
Is it a misnomer to call diabetes a disease? Because I think we think of a disease as something that can be cured.
Well, there's chronic diseases.
Right.
There's infections that can be cured. And there's certain tumors that can be cured. And anything that can be removed surgically can be cured. But diabetes is a disease, it's a chronic disease. So that's the differentiation, is that chronic diseases can be treated, but they don't go away. Even if you lose a lot of weight, and even if your blood sugar is better, there's still an underlying defect.
Even if you've had, say, weight loss surgery, and you really, and your blood sugars seem to be under control on a normal diet, it still doesn't completely go away.
Weight loss surgery does a lot, for sure. Like if you're 500 pounds and you lose down to 200, that you usually get off medicine. But there's still some kind of defect that made you gain up to that weight in the first place. So you really have to watch it after weight loss surgery. Now, a lot of times you can't get in the nutrients that you got in before. You can't eat as much. So a lot of times it stays away, or you need minimal medicine or no medicine. So weight loss surgery does help it. But what I see is over time the weight creeps back up because the genetic defect is still there. So sometimes you're better off staying on a little bit of medicine that helps the insulin work better than being off everything totally.
Now, again, I think we cover this from time to time, but it is important to say what happens when you don't take care of it.
Well, the other thing, so we talked about things that happen right then when your sugar's high, but long term, if you have sugars floating around in your blood, it sticks to everything. Sugar sticks to stuff. If you poured syrup on pancakes,
Yeah, well,
you know how it sticks, and that's the way your blood is. It's like syrup. So the higher your blood sugar, you know, the thicker the blood, and it has sugar in it, and sugar sticks to stuff. It sticks to red blood cells. That's how we measure the A1C, or the percentage of red cells that have sugar stuck to them, and that correlates with how bad your sugar's been for a while, because the red cells live in the body for 3 to 4 months. So if it's been stuck there for 3 or 4 months, then it's sticking to other proteins also. So it sticks to blood vessels, especially the small blood vessels. The smaller the blood vessel, the more it sticks. It sticks to nerve endings, it sticks to skin, it sticks to joints. So people with diabetes have lots of problems related to sugar staying high over a long period of time.
I imagine there are some patients who will say, well, I don't add sugar to anything.
Right, but you know, starches turn into sugar in your mouth. Your saliva breaks them down into sugar. So even though there's supposedly complex carbohydrates, they turn into simple carbohydrates in your mouth. So that really doesn't, you know, make that much difference.
Does most everything other than proteins eventually become sugar?
Well, fats get stored. You know, if you eat fat, if you eat peanuts or something like that, that just gets stored in your body. Proteins turn into muscle, hopefully, if you're doing some activity. But carbohydrates, so non-starchy vegetables don't really turn into sugar because there's not much carbohydrate in them. It's more fiber. So if you're eating a lot of non-starchy vegetables, you're fine. But any starches, starchy vegetables, bread, rice, pasta, potatoes, all that stuff that you're eating, that you say, well, I don't eat sweets. So that's good, but the starches turn into sugars too. So if you're having a bunch of starches and you feel sleepy after a meal because you've eaten a bunch of starches, that's because your sugar's higher.
Okay, all right. Again, we're talking with Dr. KG and Lucas from Diabetes and Endocrinology Consultants. All right, we're talking about blood sugar and the level. You know, what are some foods that are surprisingly high in sugar that people may not realize? Because like carrots or carrots.
No, carrots are fine.
Yeah.
There's a small amount of sugar, but the fiber counteracts them. Like the baby carrots that are good, they have a little bit of sugar in them, but it's no big deal.
Okay.
You can eat carrots. Eat all the carrots you want.
All right. Any though that people just have no idea about?
Starbucks.
Oh, well, that's all the added stuff. That's all they have.
It's a syrup. So if you get a flavored coffee with regular syrup, there are people with diabetes, their sugar goes like to 500 right after Starbucks. So you really have to watch what you put. You know, people say I drink coffee in the morning. I'm like, what do you put in your coffee? Because your sugar's like crazy after breakfast. And they'll put sugar in it. They'll put creamer in it. But if they go to any kind of, I'm not just picking on Starbucks, but any kind of flavored coffee, they put syrup, regular syrup.
Use half and half, you know, at home.
Yeah, I mean, you can just use cream or even milk is not that bad, but the syrup has a lot of sugar, and I think people don't realize it. I mean, a Starbucks, typical Starbucks is 500 calories. I mean, you know, for the coffee. So you need to get the skinny coffees, which means that it's sugar-free.
Mandy shaking her head.
Sugar-free syrup and
black
skim
coffee.
milk or black coffee. We get used to that. I can't stand that.
All right, so what do you put in your coffee?
I put
Truth Time
Equal and skim milk.
Okay, there you go. All right, if you can call in with your questions about diabetes and also go online and find out more at beachdoctor.com. So what about short-term, long-term goals for diabetics?
Well, what you want to do is prevent kidney damage, eye damage, nerve damage, heart disease. You want to prevent all those things by keeping your sugar controlled. So you want to keep your sugar about 80 to 120 before meals and less than 140 after meals. And you want to keep your A1C 7 or less. And that prevents you from having too much sugar sticking to your whole body, making you have kidney damage and eye damage. And that's what you want to prevent. That's why we control the blood sugar long term. It's not just a short term thing to make you feel better. It's long term, it prevents damage to all the blood vessels in your body.
How often should you have an A1C test?
Usually about every 3 months. You can go 6 months if your sugar is really well controlled.
Okay.
But usually about 3 months, because that's the turnover time for the red blood cells. So if you're trying to see an effect of your therapy, you know, you want to check it before you start the therapy. Then about 3 months later, you should see a change if the therapy's working.
A lot of diabetics have circulation issues. So is that from the syrupy nature as you're talking about?
Yes, it can be. It can be from plaques forming in the arteries related to the blood sugar. Yes.
Yeah. So that's another issue because a lot of what is it called? Diabetic neuropathy, pain
Yes.
that's associated with it.
Now the pain is more from the sugar sticking to the nerve endings. So it's not just a circulation problem. People think it is because their feet feel tingly, like if your foot goes to sleep, you know, because it's not getting blood flow. It's the same sensation. But with diabetes, it's more like the sugar sticking to the nerve endings, so it's making the nerve not send out the right signal, and the nerve sends out the wrong signal, either pain or tingling or numbness, that type of thing. So if you get numbness in your feet, the most common reason would be diabetes. So you want to, anybody that has pain in their feet for no reason or tingling, mainly in both feet, about, you know, stocking glove distribution is what they call it, but it's where your socks are. You know, so if you start getting that in both feet all the way around, that's more likely to be diabetes. Now, if you have one little area, then that could be a back problem.
Find out more at beachdoctor.com. Again, go online at beachdoctor.com from Diabetes and Endocrinology Consultants, who brings you Sugar Talk every week. We'll see you next week.
Okay, thanks.